Thank you to the team for inviting me to talk to you today about nature prescribing, nature and health, and how it can improve our personal and planetary health. So today what I'm planning to do is to talk a bit about the evidence base behind the health benefits of nature, and then to talk about Canada's National Nature Prescription Program and how we can all incorporate nature into our lives to improve our health. So I want to acknowledge that I'm giving this presentation from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations, in what is currently known as Vancouver here on the West Coast. And through this work that I do, I'm constantly grateful to the original stewards of this land who since time immemorial have made sure that the lands and the waters that we try to immerse ourselves in for our health are preserved and shared with everyone. All right, so I want to tell you a bit about my own personal journey into this space. And one of the big reasons why I'm so passionate about health and nature is because nature and green spaces are where I found my own sense of solace and my own sense of belonging when I was growing up. So I live in Vancouver now, but I was born and raised in Toronto and grew up in the suburbs of Toronto and Scarborough. And actually was fortunate enough to live in an area with a fair number of parks nearby, and we had a backyard. Our school ground was pretty big, and there was actually a fair amount of park space and green space within the grounds. But growing up in a majority white neighborhood in Toronto and being one of the very few visible minority families, unfortunately, we were frequently subject to racism, whether it was name calling or exclusion. This was something that made me feel not at home in my own neighborhood. But it was really in my father's Chinese vegetable garden in our backyard, in the park down the street, in the trees and the bushes and the green spaces on the school ground, where I felt like I belonged, and I felt like no one was going to be bullying me or judging me or excluding me. And so fast forward to my first job as a full service rural family doctor in Northern BC. So this was, I graduated from residency when I was in my mid 20s and jumped right into practice as a rural doctor. And it's pretty stressful. You're running the emergency department on your own, delivering babies in the middle of the night, caring for sick inpatients in the hospital with no specialist backup. But I found myself really, really loving it. Despite how stressful the actual clinical part of it was. And then it was when I moved to Toronto, back to Toronto, actually a year or two later, because my husband was doing his PhD at University of Toronto at the time, that suddenly we were living in downtown Toronto. And even though the work was way easier, so I was actually doing student health, outpatient student health at the University of Toronto at the Student Health Service, I found myself way more stressed. And I couldn't really quite figure out why. But I did notice that whenever I would go and do rural medicine locums, so like work stints, even though, again, the work was objectively harder, I felt more at ease. And one day I was standing in front of my window, looking out at this tiny square of sky that had the CN Tower in it, where my view was now glass and concrete instead of the trees and the mountains that I saw when I was living in Northern BC. And I thought, you know what I think the problem is? I think I'm missing nature. And so like any, good Western trained medical doctor, I thought, okay, this intuitive feeling I have that it's nature that's making me feel better can't be true unless it's backed up by randomized controlled trials and research. So I sat down at my computer and, I pulled up Medline, PubMed, and put in some search terms, and I found hundreds and hundreds of studies backing up this idea that spending time in nature is good for our health. And I thought, wow, these researchers, these scientists have been studying this for decades, and I had no idea. No one taught me about this in medical school. I don't hear anyone talking about this. This was about 15 years ago at this point. I need to make it my mission to make sure that the public and decision makers and my colleagues hear about this. And so I started talking about it, writing about it, finding the few people in the country who were working on this, and eventually connected with the BC PaRx Foundation when I moved back to Vancouver at the very end of 2015 when my son was a year old. And in 2018 helped them start working on launching our National Nature Prescription Program, and the rest is history. Anyway, that's a bit of my story, but now I want to hear from you. I want to hear how you feel, in one word, to describe how you feel when you're outside in nature. And I know some people may be listening to this afterwards, but anyone who's in the room right now, if you want to say it out loud or if you want to put it in the chat, just describe how you feel when you're outside in nature. I see Clara wrote at ease. And a lot of the words that often come up, you can probably guess, are calm. Oh, there you go. Vanessa just wrote calm. Um, happy, great minds think alike. So I often do this exercise with people, with the different groups that I'm in, and these are the words that often come up. So as you can see, the word calm came up, peace comes up, grounded, happy, restored. Someone else just wrote connected. These are all really great words. So we have this intuitive sense that we feel better when we spend time outside. And as I discovered close to 15 years ago, there's a huge amount of evidence to back that up. So these are just a couple of the many infographics out there about the health benefits of nature. The first one is taken from the Canadian Mental Health Association, and the last one is from a group in the US. They've both given me permission to use their infographics. But as you can see, from better bone density to better immune system function, reduced risk of chronic diseases like diabetes and heart disease and high blood pressure, to better depression and anxiety, reduced symptoms of ADHD in kids, less pain medication use, and earlier discharge from hospital after surgery, to better work satisfaction, spending time in nature is arguably one of the best things that we can do for our health. And I want to zero in on a couple of my favorite studies after I talk about why it's so important for me as a physician to work on prescribing nature to my patients and connecting my patients to nature. And it's because only 20 to 25% of our health status comes from what we do in the healthcare system. You know, we like to think that as health professionals, we play a big role in our patients' lives and their health. But the truth is, the majority of their health comes from factors outside my office. And if you look at a lot of these different factors that make Canadians sick or keep them well, if you think about it from another perspective, like childhood development, like a sense of social belonging, like your working conditions, having access to safe or nutritious food, your air quality, your civic infrastructure, nature access and connectedness to nature can have a huge impact on a lot of these different factors. And so knowing that, that's one of the reasons why it's so important for me to advocate outside of the health system, for my patients and larger communities to connect to nature, and for governments and other decision makers to make it easier for people to connect to nature by expanding green spaces. So you might be asking, okay, well, many of us are science trained, think critically, and we ask why is spending time in nature so good for our brains and our bodies? Like, what's behind it? And there are a couple of major psychological theories about why nature is so good for our brains. And the funny thing is, I just spent a week with a whole bunch of environmental psychologists kicking off this big national, not national, but international nature-based therapies project. And there are some debates within the profession about this. But for a general audience, the two general theories are, number one, attention restoration theory. So it says that when we spend time in these busy urban environments that 70 to 80% of us within this country live in, the busy lights and the traffic and all the commotion and the crowds tax our powers of conscious attention, which we only have a finite amount of. And what that does is it tires out our brains and makes us fatigued, makes us irritable, reduces our cognition. Whereas when we step into natural spaces or connect to nature, like a forest or like a city park or waterfront, this is a source of soft fascination. So the green space or the blue space is interesting, but it doesn't have a ton of competing stimuli to tire out your brain. So what this does is it restores your brain function. It fills back up your bucket, and makes you less fatigued and less irritable and able to think better. The second theory is called stress reduction theory, and it says that when we experience stressful events, spending time in nature or near nature can help us recover from those stresses faster. And some people think it comes down to an evolutionary perspective. So if you think about it, when you spend time in biodiverse environments that have lots of different species of trees and plants and animals, access to water, that this is an evolutionary advantage, that our brains calmed down when we were in these kinds of environments because they were less stressful, because we could hunt and catch our food and escape from predators by climbing up trees a lot more easily. And so this predilection for being drawn to biodiversity has been passed down through many generations. And so from an evolutionary perspective, our brains are hardwired to prefer to spend time in nature and biodiversity, whereas a lot of our urban environments don't give us that same benefit. There's also some really cool research that's come in the last decade or so on phytoncides, which are these volatile organic compounds that plants and trees release that fight off fungi and bacteria and insects on the plant and tree side. But when humans breathe them in and are exposed to them, there's research showing in vitro and in vivo, like in real life experiments, that people's natural killer cells, or a kind of white blood cell that fights off bacteria and viruses, and also their levels of immunoproteins increase in concentration and function. There's also evidence showing that when you just hear the sounds of nature, so the sounds of water, or lots of biodiverse birds singing, or the sound of wind rustling in the trees, that also reduces markers of anxiety and stress. Touching nature as well, if you get your hands into the soil or touch trees or sit on the forest floor, that exposes us to healthy bacteria or probiotics that help divert our immune system function in healthy ways away from allergies and autoimmune disease and towards actually fighting off the bugs and the viruses and bacteria that could actually harm us. So from our heads, our brains, to our toes, to our noses, to our ears, again, spending time in nature is really good for us from a biological perspective and from a psychological perspective. So let's talk about those studies that I mentioned. So this first study I like because, it was done in my hometown, Toronto. You can see the CN Tower there on the skyline, but also because it compares something very objectively measurable, tree cover in neighborhoods, to factors that we know have a strong correlation with health. So this study combined satellite imagery, tree data, and Ontario Health Study data and self-reports of health perception. And then they looked at the number of trees per block, and then compared how people felt about their health, kind of mapped that against the number of trees per block. And they found that every 10 more trees per block, in fact, improved people's health perceptions, similar to an increase in their personal income of $10,000 per year, moving to a neighborhood with $10,000 per year higher median income, or being 7 years younger. And I should mention that there are some pretty significant inequalities in nature distribution across cities, mapping to different socioeconomic classes. And they did control for a number of these different confounders and still found this effect. And so I like this study because we know that when you have higher income, we know that that's related to better health and well-being. We also know that youth typically is related to better health and well-being. So comparing this 10 more trees per block to income and to age is a really powerful way to get us to start thinking about how nature on our streets can improve our health and our perception of our health. Now, this study is a small pilot study that was done in Chicago, and it was a study done with 17 kids with ADHD. And they guided each child on 3 different 20-minute walks through a city park, through a downtown area, and through a residential area. And then they got them before and after to do what's called the digit span backwards score. So you just recite a sequence of numbers in a row, and then you ask the participant to recite the same sequence of numbers in backwards order. And the more numbers you can recite, the better your memory and attention. And what they found in these kids was that the 20-minute walk in the park improved their digit span backwards performance, similar to levels in kids without ADHD. So as you can see from this graph here, even though they all got the same amount of exercise for the same amount of time, it was the park walk that improved their scores significantly more than the neighborhood or the downtown walk. And in fact, the effect on the DSB rivaled in other studies the peak effects of Ritalin, which is a prescription stimulant medication, which I think is pretty incredible. So no one is saying, obviously, that a 20-minute walk in a park is going to do everything and have all the benefits that prescription stimulant medication has. But I think this study it's a really neat way to compare a nature walk or nature prescription to an actual medication prescription, and how powerful nature time can be as an adjunct to what we traditionally prescribe in the office. And it also, again, separates up that effect of exercise, which a lot of people often wonder, is it the fresh air, is it the exercise? Clearly, there was something about the park, about the biodiversity in the park, that improved their scores and their cognition better than the other walks. So it's time for a little more audience interaction. And as a physician, when I prescribe something, even if I prescribe nature, I want to think about what's the dose and how often should this patient be taking this prescription. And so I want you to guess how many hours per week we need to spend in nature to report significantly better health and well-being. And this is based on a study that came out in 2019. So if you want to put it in the chat or say it, is it 1 hour, 2 hours, 3 hours, 4 hours, or 5 hours that we need to spend time in nature to get those well-being benefits? Okay, Clara's saying 3, Vanessa's saying 3, Kayla and Cheyenne are saying 2. So the actual answer is, in fact, 2 hours or 120 minutes. And this comes from a study that was, again, done in 2019. And I actually met the first author of this study when we were kicking off this nature-based therapies project. It was like this full circle moment when he realized and I realized that we had something in common, which is pretty incredible. Matthew White here. So this was a study done of 20,000 adults in England. And they asked them to report how much time they spent in nature each week, and also report their health or well-being. And after, again, controlling for a number of different confounders, what they found was that their likelihood of reporting good health or high well-being was significantly greater when their nature contact was greater than or equal to 120 minutes or 2 hours per week, which you can see here when it starts to become significantly affect. And then these positive associations continued to accrue until they hit about 300 minutes per week or 5 hours per week. So this is why we have a standard recommendation in our program that we spend at least 2 hours in nature each week to maximize your health benefits. And, of course, the more the better. Once you hit 2 hours, you don't have to stop and say, okay, I've hit my nature dose. As you can see, 5 hours and likely even more is good for health as well. So the next question is, how much time should you spend in nature each time to get the maximal benefits? And this again comes from a study that was released in 2019. So where do you think the most efficient drop in your stress hormone, primary stress hormone, or cortisol levels happens? Is it between 5 to 10 minutes, 10 to 20, 20 to 30, 30 to 60, or 1 to 2 hours? What should your nature pill be? And I'll invite you to put it in the chat if you like. Okay. I see people celebrated the fact they got 2 hours right. So Vanessa's saying number 3, 20 to 30 minutes. Clara's saying 20 to 30 minutes as well. And okay, 10 to 20 minutes is coming from someone else, from Kayla. So the actual answer, drum roll please, is actually number 3, 20 to 30 minutes is where that stress hormone level drops the fastest. And so this was a study that was done with 36 urban dwellers over a couple months, and they asked them to have a nature experience in an outdoor place that brought them a sense of contact with nature. So this is really important. They didn't say you have to go to this specific park or this specific green space or blue space to spend time away from everyone or traffic or whatever. They said, when you feel like you've had a meaningful nature experience, you document it and, measure your salivary cortisol levels. And so they asked them to, spend time in an outdoor place that brought them a sense of contact with nature at least 3 times per week and for 10 minutes or more each time. And what they found was that their cortisol levels dropped more than 20% more after a nature experience on average. And the efficiency, the speed of that drop in cortisol was greatest, as you can see in this third discontinuous line here, between the 20 to 30 minute mark. And so that's why we also recommend in our program that you try to spend at least 20 minutes in nature each time to get that big drop in your stress. And, it's also easy to remember, at least 2 hours a week and at least 20 minutes each time. And it's really convenient that the research backs that up. But of course, if you want to spend more than 20 minutes, as you see, your cortisol is going to continue to drop. But if you're really busy like me, try to spend at least 20 minutes each time. Okay. And people often ask of me and of the BC PaRx Foundation, who hosts this program, why are you speaking to health and nature? Like, their focus is conservation, land conservation, and education. Why are you getting into nature prescribing? And it's because health is actually a really, really effective way to motivate people to make a change. So we can take some lessons about health framing from climate change research. This is a study that was done with over 7,500 participants in 5 countries. And they asked them to read 5 pairs of statements and then gave them 2 different frames per statement and asked them which frame would make them more likely to, not which frame, but which statement would make them more likely to support that policy tackling climate change. So they used, health framing, economic framing, migration framing, environmental framing. And what they found was that when they framed the policy proposal in terms of a health frame and environmental frame, that this increased support more than economic framing, for example, which had no effect on their support for that policy. So just to be clear, this is for the average everyday person. It's not, specialists or decision makers. They found that opportunity framing, so these are all the positive things that will happen when this policy occurs, increased public support more than threat framing, or these are all the bad things that will happen if we don't put this policy in place. Focusing on present impact and benefits was also more motivating for this general public audience than future impacts. And so that's why we really try to do this in our PaRx prescription program and through my work with the Canadian Association of Physicians for the Environment. I'm also president of CAPE. We really try to focus on health impacts. We really try to focus on the positive and the opportunities, because this is really more motivating for the vast majority of people to change their behavior. If you'll notice, there are a couple stars on health and opportunity. And in fact, they did a subgroup analysis that looked at people who weren't concerned about climate change. And in fact, the health framing and the opportunity framing were the only 2 frames that actually moved that group of people who weren't worried about it. And so if we want to speak to the largest audience, obviously we can be aware of the negatives, of the negative effects of climate change and other things that affect people and affect people with social inequality more. But we should always think about how we can put a positive opportunity frame on it and speak to health, because it's going to bring in the biggest audience. And as president of CAPE and as a mom who's really concerned about my future and my son's future, the fact that connecting to nature is good for the planet too is a big motivator for the work that I do. So we know that healthcare within Canada and globally is a major contributor to carbon pollution. In fact, if global healthcare were a country, it would be the 5th highest emitter in the world. And so anything that's going to improve people's health status in an evidence-based way is going to reduce our carbon footprint, our health system carbon footprint, and reduce those carbon emissions. We also know that having nature in our cities makes cities healthier from an infrastructure perspective, over and above how it makes people healthier. And I'll get into that a bit more on the next slide. And we also know that across the lifespan, that people who are more connected to nature and have more nature experiences are more likely to not only want to conserve and protect it, because it makes a lot of sense that we protect what we love, but they also engage in more pro-environmental behaviors beyond just conservation. They tend to conserve more energy, engage in more climate action, vote for climate advocates, and recycle more often, for example. So I like to think that every time one of my colleagues across the country prescribes nature to a patient and connects their patient to nature, that they're doing a small part to start to build this movement of people who care about our planet and care about each other and our future. Also, the executive director of the UN Environment Program has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. So we talk a lot about within the climate change, the climate movement, about how we need to reduce our extraction and use of fossil fuels. Of course, that's really, really important. They're responsible for more than 75% of global heating. But the truth is, at the same time, that there's absolutely no way that we are going to get to our 2030 Paris Agreement targets or to net zero by 2050 without engaging nature-based solutions for climate change that focus on expanding and restoring nature while at the same time dealing with human issues. And so right now, the estimate is if we fully embrace nature-based solutions for climate change, that this will get us over a third of the way towards our 2030 Paris Agreement targets. Right now, globally, there's probably less than 5% of total climate investments being made in nature-based solutions for climate change. So when you think about this huge potential for movement of our greenhouse gas emissions, and then the relatively tiny amount of investments that's being made in them, if we can motivate the general public, if we can engage that trusted health voice to support conservation and to vote for people who, to vote for decision makers who are going to put legislation in place to make sure that we conserve and protect nature and like our lands and waters in conjunction and in collaboration informed by Indigenous peoples. This is going to be a really great thing if we can get more people connected and supporting nature. A bit more about how nature makes our cities healthier. So this is, this map is a map of how the lower mainland of Vancouver, BC, heats up during heat wave events. And as you can see, there's this area here in the downtown east side, which is one of the most economically deprived areas in the city that physically gets hot. And it's because that area of the city is lacking green space and tree cover. There was actually an analysis done by the BC Centre for Disease Control of the over 600 deaths that occurred during the 2021 heat dome. And it showed that similar to advanced age, chronic disease, and social isolation, that actually lack of proximity to green space was a significant risk factor for mortality during the heat dome. So when you think about the fact that people with already lower health status are exposed to physically hotter environments and they lack that connection to nature that's going to make them healthier, this represents a huge inequality. So having access to nature, to green space and tree cover is not just a nice to have, it's a must have when it comes to nature equity and keeping our population healthier as climate change continues to heat our cities. Having trees on our streets and green space within our cities do a lot of positive things, from shading and reducing the need for air conditioning and energy demand to actually physically sucking air pollutants out of the air and carbon out of the air, to reducing flooding during heavy storm events and absorbing and filtering rainwater and making our actual drinking water cleaner. And it's estimated that every $1 invested in a tree actually returns up to $3 in benefits. So even though the general public isn't moved by economic arguments, politicians definitely are. So it's a good investment as well. Also, the stat that shaded surfaces are up to 25 degrees cooler than peak temperatures of unshaded ones. So having trees and green space in our cities is going to reduce that urban heat island effect, reduce flooding, and make our cities healthier for everyone who has access to nature. And if you might be wondering how we know when our cities are healthy from a green space perspective, there is this rule called the 3-30-300 rule that a colleague of mine, Dr. Cecil Konijnendijk, who used to be at UBC but is now works in Barcelona, has come up with. And this rule says that we'll know that our cities are healthy when every neighborhood across the city, in every neighborhood, that everyone can see at least 3 mature trees from their front window, when there's at least 30% tree canopy in ecologically appropriate cities, of course, across the city, and when everyone is within a 300-meter walk away from a high-quality green space. And this is backed up by a bunch of research and a bunch of guidelines that exist internationally. But I want to zero in on this 30% tree cover guideline. And a lot of the great studies to do with this research are actually coming from Australia. And so there's this amazing group in Australia who looks at tree cover and compares it to a number of different disease conditions. And they found that when controlling for a number of different confounders, again, that when a neighborhood has 30% tree cover compared to the lowest amount of tree cover, that there's a significant drop in a number of different chronic diseases and mental health conditions, from diabetes and heart disease to poor sleep and loneliness. So again, aiming for that 330-300 rule in all of our cities is a great objective to have. And in fact, Victoria on Vancouver Island here has adopted this 330-300 rule in their policy and is already working towards it. Now let's talk about my favorite topic, which is nature prescribing. And thank you for hanging on and listening for this long so far. So PaRx prescriptions, or PaRx, is Canada's national nature prescription program. And we launched it with the BC PaRx Foundation in November of 2020. And then over the next year and a half, actually spread it to every province across the country, ending up in Newfoundland and Labrador in June of 2022. And then we have a French language program in Quebec called prescrinature.ca that's run by amazing Quebec champions. But this is a program where any regulated health professional in Canada, so it's not just doctors, it can also be nurses, occupational therapists, psychologists, dentists, pharmacists, can literally prescribe nature to their patients to improve their health and well-being. And when a regulated health professional enrolls in our program, and starts prescribing nature, they're going to start to engage in what's called social prescribing, which some of you may have heard of. And so this is what the World Health Organization defines as a means of connecting patients to a range of non-clinical services in the community to improve their health and well-being. And this really allows us as clinicians to provide people with more holistic and person-centered care and empower patients to take care of themselves, which reduces stress on health systems, which we know are already overburdened. This is a picture of my son and his friend earlier in the pandemic showing off some spinach that they grew in a garden and having some good nature time. And so this social prescribing pathway is really built on this model that is, again, taken from a report by the WHO. And it's where a healthcare provider, so in our program, it doesn't have to be a primary healthcare provider, but it can be any regulated health professional, refers, so they assess the patient's need for this social prescription or this resource in the community. They refer them to a link worker, which, so in our case, we don't yet have link workers, but we're looking into that. And then that link worker then figures out, what they need and then connects them to that resource in the community. And then they follow up with the link worker and or, the healthcare provider to let them know how that experience was. And so this is nature prescribing falls under this model of social prescribing, because we're connecting patients to something in the community, meaning nature, that they need and that they would benefit from a health perspective. And if you're registered in our program, you will receive a customized nature prescription file and access to resources on our website. So you don't have to be registered in our program to actually check out these fact sheets that you can see on the right. We have 14 different fact sheets broken down by different health conditions and in adult and pediatric that talk about the specific health benefits of nature for certain conditions and health states. And they have our standard recommendation of at least 2 hours a week, at least 20 minutes at a time on them. And it's a process of working with your healthcare provider to figure out how to incorporate nature into your everyday life and reap those health benefits. And so this program has really drawn a lot of support from the health professions. We have endorsements from over 80 different major health associations and organizations across the country in every province, and also support from some parks and nature organizations. And so this actually happened fairly soon after we launched. This happened at COP26, when in fact the World Health Organization specifically singled out our nature prescribing program as a way to inspire protection and restoration of nature as the foundation of our health. And it was one of only 2 case studies from North America that were included in this big health argument for climate action report by the WHO. So this was kind of our first foray into the global nature and health space. But it was really when we announced our collaboration with PaRx Canada at the beginning of 2022, when awareness of our program really exploded internationally. So this is a program where any health professional in our program, registered in our program, can prescribe one free PaRx Canada Discovery Pass to patients per month to reduce a barrier to nature access. So sometimes people confuse our program. They think that the only thing our program is about is prescribing free PaRx passes. It's definitely not. Making sure that people are motivated to connect to nature in their everyday lives on an everyday basis in their neighborhoods is really the core of our program. But this is what put us on the map. And I just want to share a video, in fact, that the World Economic Forum put together about our program, just to kind of show you the reach that we have and encapsulate some of the research that I've been describing to you. So I'm just going to share that now. It's a really short video. Oops. So anyway, if you don't have a lot of time and you want to share information about nature prescribing or the benefits of nature with someone, just show them that 1.5 minute video. You don't actually have to get them to to watch this recording, because I think it's a really good summary. Okay, so let's keep moving on. So I just want to show you an example of our prescriber growth and how important it has been for us, kind of a health system focused initiative to collaborate with the nature sector, because this is what really set off our prescriber numbers. So after about 1 year, we did reach the 1,000 prescriber mark. But as you can see, after the PaRx Canada collaboration, all the publicity we got, our prescriber numbers went up exponentially. And I think one of the big reasons is that we could now offer something that in a tangible way reduced a barrier to nature access for our patients. And so as of now, we have close to 12,000 prescribers within our program, all regulated health professionals. Across Canada, it's over 5% of all practicing doctors. And in British Columbia, where I live, it's close to 15% of all doctors. So it's amazing. And when you think about the fact that there's research showing that when 3.5% of a population is engaged in a movement, that movement is going to succeed, within the health profession, it looks like we've gotten there, which is pretty incredible, but which is also really has been dependent on the support of the Canadian Association of Physicians for the Environment. There's no way that we could have amplified and scaled this across the country without champions in each regional committee stepping up, making those local connections with health organizations and becoming spokespeople and champions. There's no way that we could have done it on our own. So we owe a huge debt of gratitude to CAPE and to those nature champions across the country. Another milestone that we reached was when the Canadian Medical Association officially, formally endorsed PaRx at COP15, or the Biodiversity COP in Montreal in December last year, and actually enshrined a recommendation for nature prescribing to be taught in medical schools and adopted into practice within official CMA policy. So that happened in October of 2022. And Both of these are the first time that any National Physicians Association has made this recommendation enshrined in nature prescribing and policy or endorsed in nature prescribing program. So we were really, really grateful for that first, and that we got to announce it at COP15 at the Canada Pavilion. There's a huge amount of interest globally in scaling nature prescriptions. I think I mentioned earlier that I was participating in a big EU-based nature-based therapies project last week. And so this is a €6.3 million project that looks to both expand the research base and knowledge base around the connections between nature and health through different randomized controlled trials and other kinds of studies, but also is seeking to amplify nature-based therapies and scale them up globally. So that's what I'm really excited about, is translating that research into action and more people on the ground having access to those therapies. PaRx Prescriptions is also part of a big Australian trial that's looking at nature prescriptions and physical activity in people with cardiometabolic diseases. So we're really excited to be part of that. And this hasn't been announced yet, but we're also part of a big Canadian Institutes for Health Research grant as well that's kicking off, looking again at cardiometabolic disease and nature prescribing and how that can help. So tons of momentum, both nationally and globally. In terms of what's next for us, we're hoping to launch nature prescriptions in the territories, and we've made some good headway there. Something that we really want to be cognizant of and sensitive to is the fact that the population in the territories is majority Indigenous. And the question is, how do you prescribe nature? How does a Western practitioner prescribe nature to someone whose culture is so rooted in connection to the land? And so we're having some good conversations with researchers and community members up there to eventually launch nature prescribing in the territories in a sensitive way and in a good way. We also recognize that park passes are not the only barrier or not the only benefit that patients need for access to nature. And so we've been having conversations with different transportation and community and other organizations to try to further reduce barriers to nature access. We frequently hear that transportation is one barrier. And then we've been working on our PaRx Prescriptions app, which is going to track and incentivize nature time and give us more data on how people are filling their nature prescriptions. So in terms of what I'm hoping you take away with you today, in terms of what you can act on, because we know that nature is so good for us, I ask that you try to spend at least 2 hours in nature each week and at least 20 minutes each time so that you can be resilient and that your health can be wonderful. And recommend that to your family and friends. And then also, in whatever way you can, support decision makers to green cities, remembering that 330-300 rule, and also support their work to conserve nature and biodiversity. We know there was a huge win that happened over the past week with the provincial government in Ontario reversing the decision to develop the Green Belt. And that was the result of huge amounts of advocacy from environmental groups, from community members, and from everyday people. So it's just incredible what we can do when we join forces and collaborate. If you have any health professionals in your life, doctors, nurses, other health professionals, spread the word to them about the nature prescription program to see if they're interested in enrolling and prescribing. Within Ontario, we actually have a partnership with the Canadian Museum of Nature, where if you're in the greater or the National Capital Region, you can be prescribed free family passes to the Canadian Museum of Nature. And I don't think I'm letting the cat out of the bag, but tomorrow I'm actually going to be in Toronto at the Toronto Zoo announcing a new collaboration with the zoo where practitioners can actually prescribe. If you show your prescription out the gate, you can get 50% off admission to the zoo. So anyway, there's a lot of great stuff happening. And then also, if you know a nature-based organization or venue like the zoo or like the Canadian Museum of Nature, please connect us, because we're always looking for ways to reduce barriers for people to access nature. I want to share one more video before I share my last slide. And this speaks to why we do what we do. There's nothing that I love more as a physician, as a clinician, at seeing the impact that my care and our care actually has on the lives of our patients. So I want to share the story of one patient, Marjorie, who was one of the first patients in our program to be prescribed nature by one of my colleagues, actually. And CNN actually visited us about a year or so ago to put a story together about Marjorie and her experience in our nature prescription program. So I just want to share Marjorie's story with you here. If I can, actually. How do I get to her? Oh, here we go. Okay.
About a year ago now, I was in talking to my doctor, and I just said, I can't shake this depression. He says, I've got just the thing, a prescription for you. I thought, oh, goody, one more pill. And he says, no. I want you to spend 2 hours during the week outdoors, minimum 20 minutes each time. And the more I did it, the better I felt. So it all came together way better than any medication I've ever had.
Now, you know she's 75, so I've got to tell you that I'm 91. So that's why she takes care of me.
I do try.
Nature is everywhere. We can find it in the most unexpected places, and nature is health. PaRx Prescription, or PaRx, is Canada's national nature prescription program. What the physician or nurse does is they sit down with the patient and they figure out what kind of nearby nature is in their community, and then they work with them together to come up with a plan where they can incorporate nature time into their everyday lifestyle.
Some cherry tomatoes. So this is the prescription, and it just gives my name, and it says my outdoor activity plan.
In 2022, we announced a new collaboration with PaRx Canada, where licensed health professionals can now prescribe national discovery passes that give you entry to national parks. There are only 2 national nature prescription programs in the world, and the first one was actually founded right in the US. Cost can be a barrier where there are day use fees, so we're hoping that by prescribing these PaRx Canada discovery passes, that will reduce that barrier to nature access in a significant way. Well, there are 2 major theories as to why nature is so good for our brains, and the first one is called attention restoration theory. When we spend time in busy urban environments, all the hard edges and traffic and lights and people everywhere really make us have to constantly focus our attention to kind of navigate around those obstacles. Whereas when you spend time in nature, it's really this source of soft fascination. So what that does is it restores your powers of attention and it reduces that fatigue and irritability. The second major theory is called stress reduction theory. So basically, when we spend time in nature after stressful events, it helps us be more resilient and recover faster. When I recommended nature for the first time to a patient of mine, I thought he's going to look at me funny and he's going to laugh at me. But he actually just nodded his head and said, you're absolutely right. When I spend more time in nature, I feel better. And so I think healthcare providers sort of have to get over our own mental biases against new sort of lifestyle interventions and prescribe something evidence-based like nature time more often.
50 days from seed to vegetable. I think the prescription helps in that it says this is a good thing to do, this is worth the effort to do. You need to get out of doors and just be surrounded by the greenery and by nature.
I want people to know that nature should be a non-negotiable. The thing about heading outside is that you tend to start to naturally be more active. You'll feel calmer, you'll feel less depressed, less anxious. I think it's just a great way to deal with the stresses of modern life.
I love Marjorie's story. It makes me smile every time I see her and her 91-year-old partner cuddling there. And so I want to leave you with this last idea and this last experience that I had. And it was over March break, actually spring break with my family, when we finally had some time to steal away to Fino to get some nature time and connect amid our really busy lives. And we were just coming back from the beach, walking on the trail, and I happened upon this sign. And the words really jumped out at me. The words that said, there's no concept of the word wilderness in the Nch'olnith language. The closest translation is Watyu, meaning home. And this is an experience I've had throughout my entire life, growing up in Toronto, as a busy new family physician, and today is feeling at home when I'm in nature. And I hope that you take that feeling of home with you and that you spend as much time outside as you can for your health from this day forward. Thanks.